So this is a severe case of periodontitis with a lot of labial plate bone loss. So in the interforaminal region, we have placed a smooth surface basal implant. You can see there is no labial plate, but lingually there is good bone. So we have selected a smooth surface basal implant, 3.620. This is in the anterior area, 3.620. This is also 3.620, and we can see the there is no labial plate at all. Lingually there is good bone. The left distal mandible, we have placed a 3.58 compressive implant. The nerve also is very close. We can see the mental foramina and the loop exiting here. So here also the nerve is very close, so we have tilted the implant towards the lingual side. This is also 3.58 compressive rough surface basal implant. So the right side mandible, this is 3.510. See, the nerve is very close. So the distal most implant is we have tilted it slightly buccally to avoid the inferior nerve. This is also 3.58. Very short implants we have placed in the distal mandible.